Good afternoon, Mr. Alan Bernat. My name is Aida and I'm a student at United States University taking nurse practitioner, and I'm here today to do your neurological exam. But before we start everything, I would like to ask permission from you if it's okay for us to videotape the process so my instructor could review the neurological examination done.
Sure, you can.
Okay, with the neurological exam, there are 5 areas that we are going to check today. Memory, the cranial nerve, the sensory, the motor, and the deep tendon reflexes. And just follow my cues because every examination that we do, there are some specific instructions that I need you to follow. So first one is, we'll do the memory. Would you state your name and your date of birth?
I'm Alan Bernat. I was born March 26, 1965.
What's your current address?
33831 North Summerfields Drive, Kearney, Illinois.
Do you know what's the date today?
July 17, 2019.
Who's the current president of the United States?
Donald Trump.
Will you state who were the 2 previous presidents of the United States prior to Donald Trump?
George Bush and Barack Obama.
So who's the first, who's the previous to Obama?
George Bush.
And then?
And Barack Obama. And then Donald Trump.
All right. What did you eat for breakfast today?
A piece of bread and a cup of coffee.
Will you tell me what's the first model of your car?
1995 Toyota Corolla.
All right, thank you. Next one is we're gonna do the cranial nerves. The first cranial nerve is called the olfactory nerve. So with your eyes closed and one of your nostrils covered, I need you to identify what the smell that I'm going to let your nose smell. So the first one is, let's do your left. No, cover your eyes. Will you tell me what do you smell?
It's vanilla.
Okay, thank you. Remain with your closed eyes. Cover this time your left nostril. And can you smell that?
Chocolate.
Okay, thank you. You can open your eyes now. The next cranial nerve is what we call the optic nerve. Do you wear your eyeglasses all the time?
Yeah, it's
Do
a
you have
prescription glasses.
Okay, do you have prescription glasses? So we'll check first your visual acuity using what we call the Snellen's test. So with me apart from you, I'm going to ask you with one of your eyes covered right now. You can start either the left eye or the right eye. Please try to read the smallest that you can see. Let's try this bottom line.
LTFFM.
Okay, very good. How about the next one?
CFDHG.
Okay, let's cover the other eye and let's do the lowest or the smallest one.
LTFFN. H or something.
Okay, let's do the second one here.
CFDHJ.
All right, thank you. With both eyes uncovered, will you try to read the smallest one?
LTFFH.
All right, the other one.
CFDHG.
Okay, so that would be with the Snellen's test. The next one is I'm going to test your visual field for with confrontation. So with your eyes, with your one eye covered, tell me when you can see my fingers, okay?
Yes.
Okay, cover the other eye.
Yes. Yes.
Okay, with your both eyes uncovered, tell me when you can see my fingers.
Yeah. Yeah.
Okay. The next one is I'm going to apply a light on your eyes, and I'm going to check for your retina, your optic nerve, and the blood vessels in your eyes. Would you mind taking your eyeglasses, please? Okay. So with my right eye and your right, okay, I can see that. All right, I could see your optic disc, your retina, and the blood vessels. So now I'm going to do your left. With my left eye, okay, I could see that, your optic nerve, your blood vessels, and your retina. Okay, so that would be the optic nerve. The next cranial nerve would be, we'll check for cranial nerve number 3 together with 4 and 6. This will check the eye ocular movement. The 4 will be cranial nerve number 4, which is the trochlear nerve, is responsible for your eye movement downward and medially. And then the cranial nerve number 6 is the abducens, that will be responsible for the lateral movement of your eyes. Okay, so we'll do the oculomotor first, which is the third. I will again have some light in your eyes. This is where we're gonna check your pupillary reflex, and this will check for we will check for the direct and then the consensual. So with your right eye, okay, 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 let me do it again. Okay, there's no nystagmus there. Then follow my fingers, okay? Don't move your head, but just your eyes. All right, let's try this. Okay. All right, so that would be for the 3, 4, and 6. The next cranial nerve is cranial nerve number 5. This is the trigeminal. So I'm going to apply to check the sensation on your forehead, in your cheek, in your jaw. You let me know whether it's soft or it is with pain or sharp.
Soft. 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 Pain.
Or sharp.
Sharp, yeah. Sharp. Sharp. Soft. 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 Again, please. Pain.
Or sharp.
Yeah, sharp. Sharp.
Okay. Next one is if you could move your jaw. All right. Next one we have cranial nerve number 7, which is the facial nerve. So with facial nerve, can you please smile? Okay. And then frown. All right. The 8th cranial nerve is called acoustic nerve. So I'm going to go behind you, cover your one ear, and then I will say or whisper a word, and then tell me if you can tell me what it is. Okay, can you cover your left ear?
1, 2, 3.
Okay, cover your right.
How are you?
Okay, thank you. Next one is we are going to test for Ryan's test and Weber's test. This is to test the air conduction and the bone conduction. So, tell me if you can hear it both sides.
Yeah.
Okay. With this one is you tell me when you cannot hear it anymore, and then I will move the tuning fork. One more.
Yeah.
Okay.
Yeah. Yeah.
Okay. So that is cranial nerve number 8. Cranial nerve number 9 and 10. This is the glossopharyngeal and the vagus nerve. This is to check your palate, your larynx, and your pharynx. This will check for your swallowing and your gag reflex, and I will check your uvula, making sure it's in the midline. Will you do swallowing for me? Okay, that is it. Well, can you say Okay. Right, one more. Okay, push your tongue down. Tongue down. Okay. And then cranial nerve number 11 is the spinal accessory. This is, I'm going to put pressure on your sternocleidomastoid muscles and then see if the strength is. Okay, thank you. And the last one is we have the cranial nerve number 12, which is the hypoglossal muscle. This is to check this is I need your tongue out and then movement to the side and one side. Okay, thank you. So those are the cranial nerves. The next one is we are going to check your cerebellum. What I need you to do, if you can stand up and then just take a normal walk. Okay, all right. When you come back, if you can do a tandem walk for me. Let me just push the chair back a little bit so you have space. When you say tandem is you are walking in one line. Okay? Alright. Okay. Thank you. Alright. The next one is if you can walk on your toes. Alright. How about walking on your heels? Okay, so the next test that we're gonna do is if you can just stand, close your eyes, put your feet together, and then stretch your arm full with your palm up, and then just stay like that. Okay? All right, next one is that's for the Romberg's test. You put your feet together while closing your eyes. Okay, next one is the pronator's drift. Okay, and that would be with the cerebellum testing. Okay, you can sit now, and then we will check for fast alternating movement so you can follow me. So if you can do that and do as fast as you can. Okay, the next one is we're gonna do the finger to nose. So you're gonna touch your nose, and then I'm going to put my finger in the ear and you can touch my finger. Okay, so let's start that. Okay, one more. Okay, another one. Okay, so that would be the testing for the cerebellum. The next one is we are going to check for the sensory testing, and the first one is we are going to do what we call the joint position sense. So with your eyes closed, I'm going to do your fingers first and then your toes. You tell me when I move your finger or your toe, whether it's up or down. Okay? So stretch your arm. Okay.
Down.
All right.
Up.
Okay. You can relax your hand. Let me do your toes. Can you lift it a little bit? Okay.
Up. Down.
Okay. You can open your eyes. So that's the first test. The second test is we are going to do the 2-point discrimination. So I'm going to apply a sharp stimulus and you tell me whether it's just a 1-point or a 2-point. So with your eyes closed, okay, we're gonna do your upper extremities first.
Sharp.
You have to tell me whether it's a 2-point or a 1-point, meaning if it's only 1 tip or 2 tips that touching your skin. Can we redo that?
Okay. 1. 1. 1. 1. 1. 1.
All right.
1. 1. 1.
So we're gonna redo this test because some of the 2 points you're just saying 1. So there's 2 tips. So if I'll break down to your skin, try to feel whether it's the 2 sides or just the 1 side.
Okay.
Okay? All right, let's do that testing. It's a 2-point discrimination. With your eyes closed, please.
2. 1. 1. 1. 1. 1.
Okay. All right. The next one is I'm going to, most of the testing here is with the eyes closed. So the next one is I'm going to draw something in your palm with your eyes closed and you tell me what did I draw. So well, this is what we call as graffitisia. So let me draw something. You close your other palm first and then let's start with your right arm. Your right hand. What did I draw?
Again, please. H.
Alright. Next one is for your left palm.
R. Okay. Again, please. Sorry. 3.
Okay, thank you. Next one is what we call stereognosis. I'm going to put an object on your palm with your eyes closed again. We'll do 1 palm at a time. Tell me what you identify what's the object. Okay, with your eyes closed, please. All right, let me start with your right palm. Can you tell me what's that?
Banana.
Okay, thank you. All right, for your left palm, tell me what's the object.
It's a canister.
Okay, it's a can, it's a container.
It's a container here. It's like in a box.
Okay, thank you. The next one is we are going to check your superficial tactile sensation. So you tell me whether it's soft, it's dull, or it's sharp, or it's pain.
Okay.
Okay, we'll do those on your all extremities. So we'll start with your arm, with your eyes closed. Tell me if it's soft, or dull? We'll just do two.
Again, dull, soft,
Let's redo it. Let's just do dull or sharp or pain. Okay, just
Okay.
the two. Dull
Dull.
or sharp.
dull, sharp, dull, sharp, again, dull, sharp, dull.
Okay. All right. Thank you. The next one is I'm going to apply some vibration on your toes, and you tell me if you can feel it. Okay?
Yeah,
Hold on.
yeah,
Okay.
yeah.
Okay. All right. Thank you. So that is with sensory. Next, we are going to check for your motor, and this is just checking for the strength, the tone of your muscles, and check for atrophy. The range of motion is in the musculoskeletal. So can you sit up straight, please? Okay, so that would be checking how's your muscle tone, because it supports your posture while sitting. The first one we're gonna do is your fingers. So with your arm stretch, I will try to close your fingers, but you will try to resist it and try to open it. Okay, we'll do both sides. So let me try your right first. Okay, there's a good resistance there. It's a grade 5. Next one is with your, make a fist for me, and then palms down. I'm going to try to flex your wrist and try to resist it. Okay. All right. Okay. With your fingers, I will redo my testing. I'm sorry. I will try to open it while the fingers are closed, and then try to resist it. Okay. All right. One more on your left. Okay. Thank you. So there's a resistance to that. Next one is with your hands like this. I'm going to check your elbows. I'm going to try to extend it and see if, okay, all right, okay, other side, and then, okay. Next one is I'm going to do your shoulders. I'm going to try to abduct it or push it away from your body and bring it towards your body. So if you can do this, okay. I'm going to push this away, try to resist, okay. And then the same thing here. And then I'll try to make, okay. All right, thank you. So that would be for your shoulders. The next one is I'm going to do your knee. So with your knee, I'm gonna push it up, meaning is to do an extension, and then try to resist the movement. Okay, and then I'm going to try to flex your knee by pushing down. The same thing on the right side. Okay, push up, which is to extend the knee, and then flexion. Okay, next one is we're gonna do your feet. So I'm gonna try to push it upwards, which is the plantar flexion. Then I'm gonna push it downwards, which is the dorsiflexion is pushing upward, and then going downward is the plantar flexion. Okay, so try to resist. All right, let me push this down. push it down. Okay. One more. Okay. All right. Strength for those are grade 5. I'm going to request you to lay down so I could check for
On my back?
your no,
On my
not in
belly.
your back, but on your
Belly?
sorry, lay on your back so I could check your muscles on your hips. So first is I'm going to flex your knee, and then I'm going to try to push it down. Try to have some resistance so I could check the strength, okay? So I'm going to push it down, okay? And then I'm going to push it up. All right, let's do the other one. So with your flex knee, let me try to push this down, okay? And then let me try to push it up. Okay, next one is with your knees bent, both of it. Okay, I'm going to keep it and I'm going to try to separate both, okay? All right, and then with the two knees separated, I'm gonna try to push it inwards, which is towards your body, so try to resist. Okay, all right, so you can relax, and then I'm going to check for your hips. I'm going to flex this, and then I'm going to push it inward, okay? So that is adduction, and then I'm going to push it away, which is abduction for your right. The other one is the left side. I will do the same thing. Okay, let me push it away, which is abduction, and then I will push it inward, which is adduction. And that would be our checking for our motor. The last one is our if you can sit down again, we will do our deep tendon reflexes. If you want to sit in the chair again. So there are 5 reflexes that we are going to check. So the first one is just relax. Okay, we're gonna check the biceps. Try to relax. Okay, just relax. I could feel the okay. All right, very good. Next is we have the triceps. Just kind of relax. One more. Okay, relax. Okay, one more here. Okay. Relax, relax. I could feel the all right, there you go. All right, we will test your brachioradialis. Okay, and see, relax again. Relax. Okay, one more here. Relax, because I could relax. Okay, the next one is we have to check your patellar reflex. So again, I need you to relax. Just all right. All right, very good. Very good. So next is I need to, probably you can lay here. So your lay on your tummy. So your heels can be facing upward. It will be easier to test that way. Okay. The next one is we are going to test. There we go. Thank you. Your Achilles. Okay. Okay, there you go. And then the Babinski will be another, it's a superficial testing wherein we are going to put the stimulus here in a in a C position. All right. Okay, that toe did not shape like a fan. All right, thank you. And the last superficial reflex would be in the last two would be in the stomach. So from the umbilical area, we are going to apply a stimulus, and you know, I'm just going to explain it. When we apply a stimulus here from the umbilical area towards outside of the abdominal area, while we're doing this, it should we should be able to visualize the movement of the abdominal muscles. And then the other one is with the male, stroking the inner thigh could cause it will cause some rectal sensation. And I think that's pretty much it. All right, thank you.